Imagine getting sick, not with something rare, but something easily treatable, and knowing that the nearest doctor is hours away, medicine is too expensive, and the hospital doesn't even have electricity. For millions of people around the world, this isn't imagination, it's reality. One of the most critical reasons poor countries struggle with healthcare is the lack of sufficient funding. Governments in low-income nations often operate with very limited financial resources, which makes it difficult to prioritize healthcare spending. These countries usually depend heavily on small tax bases because a large portion of their population lives in poverty or works in informal sectors where income is not properly taxed. As a result, the government collects less revenue and must stretch its budget across many essential sectors such as education, security, infrastructure, and social services. Healthcare, although extremely important, often receives a smaller share than it truly needs, leading to weak and underdeveloped systems. Because of limited funding, hospitals and clinics frequently lack basic medical equipment and supplies. Essential items such as clean water, electricity, sterilization tools, and life-saving machines may not be consistently available. In some cases, hospitals operate with outdated or broken equipment that cannot properly diagnose or treat patients. This severely reduces the quality of care and increases the risk of complications or death from otherwise treatable conditions. Even simple resources like gloves, syringes, or medicines can run out, forcing healthcare workers to make difficult decisions about who receives treatment and who does not. Another major consequence of insufficient funding is the poor condition of healthcare facilities. Many hospitals in low-income countries are overcrowded, poorly maintained, and lack proper sanitation. Patients may be forced to share beds, lie on floors, or wait for long periods before receiving care. Without enough financial support, governments cannot build new hospitals or expand existing ones to meet the needs of growing populations. This creates a situation where demand for healthcare far exceeds supply, putting immense pressure on already struggling systems and reducing the overall quality of patient care. In addition to infrastructure problems, lack of funding also affects the availability and motivation of healthcare workers. Doctors, nurses, and medical staff in poor countries are often underpaid and overworked due to limited budgets. Low salaries make it difficult to attract and retain skilled professionals, especially when they have opportunities to work in wealthier countries for better pay and working conditions. This leads to a shortage of qualified personnel, which further weakens the healthcare system. Those who remain are often exhausted and unable to provide the level of attention and care that patients need. Furthermore, limited funding restricts the development of preventive healthcare programs. In well-funded systems, governments invest in vaccination campaigns, health education, early screenings, and disease prevention strategies. However, in poor countries, the focus is often on treating illnesses rather than preventing them, simply because there are not enough resources to do both. This leads to higher rates of infectious diseases, malnutrition, and preventable conditions, which place an even greater burden on the already underfunded healthcare system. Over time, this creates a cycle where more people get sick, increasing the demand for healthcare that the system cannot handle. Finally, reliance on external aid highlights the funding challenges faced by poor countries. Many low-income nations depend on international organizations, charities, and foreign governments to support their healthcare systems. While this aid can be helpful, it is often inconsistent and may come with conditions that do not always align with the country's specific needs. This dependence makes healthcare systems unstable and vulnerable to changes in global priorities or economic conditions. Without strong and sustainable domestic funding, poor countries struggle to build reliable healthcare systems that can serve their populations effectively. Another major reason poor countries struggle with healthcare is the severe shortage of healthcare workers. Doctors, nurses, midwives, and other medical professionals are essential for delivering quality care, yet in many low-income countries, their numbers are far below what is needed. This shortage is not just a minor gap, it is often a critical crisis. In some regions, a single doctor may be responsible for thousands of patients, making it nearly impossible to provide timely and effective treatment. The imbalance between the number of healthcare workers and the population leads to long waiting times, rushed consultations, and reduced quality of care. One of the primary causes of this shortage is the limited capacity for medical education and training within poor countries. Many nations lack enough medical schools, training facilities, and qualified instructors to produce a sufficient number of healthcare professionals. Even when students are willing to pursue careers in medicine, they often face barriers such as high tuition costs, limited seats in institutions, and inadequate training resources. As a result, fewer individuals are able to enter the healthcare workforce, and the system struggles to replace retiring professionals or meet growing demand. Another significant factor is the phenomenon known as brain drain. Many trained doctors and nurses leave their home countries to work in wealthier nations where salaries are higher, working conditions are better, and career opportunities are more promising. This migration creates a serious gap in the healthcare systems of poor countries. Governments invest time and resources in training these professionals, only to lose them to other countries. The loss is especially damaging because it often involves the most skilled and experienced individuals, leaving behind a workforce that may be less experienced and more overwhelmed. Working conditions in poor countries also contribute to the shortage of healthcare workers. Many medical professionals operate in challenging environments where resources are scarce, equipment is outdated, and facilities are overcrowded. They may have to work long hours without proper rest, handle a high number of patients daily, and deal with emotionally and physically exhausting situations. In addition, the lack of support staff and infrastructure increases their workload. These difficult conditions can lead to burnout, stress, and job dissatisfaction, causing some workers to leave the profession altogether. Low salaries and limited financial incentives further discourage people from entering or staying in the healthcare field. In many poor countries, healthcare workers are not paid enough to support themselves or their families comfortably. This lack of fair compensation reduces motivation and makes other professions more attractive. For those already in the field, financial struggles may push them to seek better, paying jobs abroad or in private sectors, reducing the number of professionals available in public healthcare systems where they are needed most. The shortage of healthcare workers also has serious consequences for patients and communities. With too few professionals available, access to healthcare becomes limited, especially in rural and remote areas. People may have to travel long distances just to see a doctor, and even then, they may not receive proper attention due to overcrowding. Preventive care, maternal health services, and emergency treatments all suffer when there are not enough trained workers. This shortage weakens the entire healthcare system, making it less responsive, less efficient, and less capable of improving public health outcomes. Another major factor that explains why poor countries struggle with healthcare is the issue of poor infrastructure. Infrastructure in healthcare refers not only to hospitals and clinics, but also to roads, transportation systems, electricity, clean water supply, and communication networks. In many low-income countries, these essential systems are underdeveloped or unreliable, making it extremely difficult to deliver healthcare services effectively. Even if trained doctors and medicines are available, without proper infrastructure, reaching patients and providing timely care becomes a serious challenge. One of the most visible problems is the limited number of healthcare facilities. In many poor countries, especially in rural areas, hospitals and clinics are few and far between. Large populations may depend on a single health center that is often small and overcrowded. This creates long waiting times and reduces the quality of care patients receive. In some remote regions, there may be no nearby healthcare facility at all, forcing people to rely on traditional remedies or delay seeking treatment until their condition becomes severe. The absence of nearby clinics significantly increases the risk of complications and preventable deaths. Transportation is another critical issue linked to poor infrastructure. Many roads in low-income countries are poorly maintained, unpaved, or completely inaccessible during certain seasons, such as during heavy rains or floods. This makes it extremely difficult for patients to travel to hospitals, especially in emergencies. Ambulance services are often limited or non-existent, and even when available, they may not be able to reach certain areas quickly. As a result, people suffering from injuries, childbirth complications, or serious illnesses may not receive medical attention in time, leading to avoidable loss of life. In addition to transportation challenges, unreliable electricity and water supply further weaken healthcare systems. Many hospitals in poor countries face frequent power outages, which can disrupt critical medical procedures. Equipment such as ventilators, incubators, and diagnostic machines depend on a stable power supply to function properly. Without electricity, surgeries may be delayed or performed under unsafe conditions, and essential medicines that require refrigeration may spoil. Similarly, the lack of clean water makes it difficult to maintain hygiene and sanitation, increasing the risk of infections within healthcare facilities. Communication infrastructure also plays a key role in healthcare delivery, and its absence creates additional barriers. In well-developed systems, communication technologies allow hospitals to coordinate care, share patient information, and respond quickly to emergencies. However, in many poor countries, limited internet access and weak telecommunications networks prevent efficient communication between healthcare providers. This can delay diagnosis, treatment, and referrals, particularly for patients in remote areas who need to be transferred to larger hospitals. Poor communication also limits public health campaigns and awareness programs, making it harder to educate communities about disease prevention. Finally, weak infrastructure affects not only patients but also healthcare workers. Doctors and nurses may be reluctant to work in rural or underdeveloped areas where facilities are inadequate and living conditions are difficult. This further increases the imbalance between urban and rural healthcare services, leaving remote populations even more underserved. Without investment in infrastructure, healthcare systems cannot grow or improve. The lack of proper facilities, transportation, utilities, and communication networks creates a chain of obstacles that prevent effective healthcare delivery and continue to widen the gap between rich and poor countries. Another major reason why poor countries struggle with healthcare is the high cost of treatment, which prevents many people from accessing even the most basic medical services. In low-income countries, healthcare is often not fully supported by the government, meaning patients must pay directly for consultations, tests, medicines, and hospital stays. This system, known as out-of-pocket payment, places a heavy financial burden on individuals and families who are already struggling to meet their daily needs. As a result, healthcare becomes a luxury rather than a basic service that everyone can access. For many families living in poverty, even a simple visit to a doctor can be financially overwhelming. The cost of transportation to a healthcare facility, consultation fees, and prescribed medicines can quickly add up. In such situations, people are often forced to make difficult choices between spending money on healthcare or on essential needs like food, education, and shelter. This leads many individuals to delay seeking medical help until their condition becomes severe, making treatment more complicated and expensive in the long run. The absence of health insurance systems in many poor countries further worsens the situation. In wealthier nations, insurance helps cover medical expenses, reducing the financial burden on patients. However, in low-income countries, insurance coverage is often limited or non-existent, especially for those working in informal sectors. Without financial protection, people must bear the full cost of treatment themselves. This lack of safety net means that a single illness or medical emergency can push an entire family deeper into poverty. High costs also affect access to essential medicine. Many life-saving drugs are either too expensive or not readily available in poor countries. Patients may be unable to afford the full course of treatment, leading them to take incomplete doses or rely on cheaper, less effective alternatives. This not only reduces the chances of recovery, but can also contribute to the spread of diseases and the development of drug resistance. In some cases, individuals may turn to unqualified practitioners or traditional remedies simply because they are more affordable, even if they are less effective or unsafe. Hospital care, particularly for serious illnesses or surgeries, is even more financially demanding. The cost of hospitalization, diagnostic tests, and specialized treatments can be far beyond what an average family can afford. In many cases, families are forced to borrow money, sell assets, or take on debt to pay for medical expenses. This creates long-term financial instability and can trap families in a cycle of poverty. The fear of these high costs often discourages people from seeking hospital care altogether, even when it is urgently needed. The high cost of treatment not only affects individuals, but also weakens the overall healthcare system. When people avoid or delay medical care due to financial barriers, diseases spread more easily and become harder to control. Preventive care is neglected, leading to higher rates of illness and increased pressure on already strained healthcare facilities. Without affordable healthcare, the gap between those who can access treatment and those who cannot continues to grow, making it even more difficult for poor countries to improve their health outcomes and overall quality of life. Another significant reason why poor countries struggle with healthcare is the lack of education and awareness among the population. Health education plays a crucial role in helping people understand how to prevent diseases, recognize symptoms, and seek timely medical care. However, in many low-income countries, a large portion of the population has limited access to basic education, which directly affects their understanding of health-related issues. Without proper knowledge, individuals are less likely to make informed decisions about their health, leading to higher rates of illness and complications. One of the key problems caused by limited education is the inability to recognize early symptoms of diseases. Many people may ignore warning signs or fail to understand the seriousness of their condition. For example, symptoms like persistent fever, fatigue, or pain might be dismissed as minor issues rather than indicators of serious illnesses. As a result, individuals often delay seeking medical attention until their condition becomes severe. This delay not only reduces the chances of successful treatment, but also increases the cost and complexity of care. Lack of awareness also affects preventive healthcare practices. In well-informed communities, people are more likely to adopt healthy habits such as maintaining hygiene, getting vaccinated, eating balanced diets, and seeking regular check-ups. However, in poor countries, many individuals are unaware of these preventive measures or do not fully understand their importance. This leads to the spread of preventable diseases such as infections, malnutrition, and waterborne illnesses. Without proper education, efforts to control and eliminate these diseases become much more difficult. Cultural beliefs and misconceptions further contribute to the problem. In some communities, traditional beliefs and misinformation may discourage people from seeking modern medical treatment. For instance, illnesses may be attributed to supernatural causes rather than medical conditions, leading individuals to rely on traditional healers instead of trained healthcare professionals. While cultural practices are important, reliance on unscientific methods can delay proper treatment and worsen health outcomes. Education plays a key role in addressing these misconceptions and promoting trust in modern healthcare systems. Another important issue is the lack of awareness about maternal and child health. In many poor countries, women may not have access to education about pregnancy, childbirth, and infant care. This can lead to unsafe practices, such as giving birth without skilled medical assistance or failing to provide proper nutrition and care for newborns. As a result, maternal and infant mortality rates remain high. Educating communities about safe practices and the importance of medical care during pregnancy can significantly improve health outcomes for both mothers and children. Finally, the lack of public health awareness campaigns limits the spread of important health information. In developed countries, governments and organizations actively promote health education through media, schools, and community programs. In contrast, poor countries often lack the resources to conduct widespread awareness campaigns. This means that important information about disease prevention, vaccinations, and available healthcare services does not reach those who need it most. Without awareness, people cannot take advantage of the limited healthcare services that do exist, further weakening the effectiveness of the entire system. Another major reason why poor countries struggle with healthcare is political instability and corruption, which significantly weaken the effectiveness of healthcare systems. Political stability is essential for long-term planning, policy implementation, and the proper allocation of resources. However, in many low-income countries, frequent changes in government, internal conflicts, and weak institutions make it difficult to maintain consistent healthcare policies. When governments are unstable, healthcare systems often become disorganized, underfunded, and unable to meet the needs of the population. Political instability often leads to conflicts and crises that directly damage healthcare infrastructure. Wars, civil unrest, and violence can destroy hospitals, clinics, and medical supply chains. In such situations, healthcare services may be disrupted or completely unavailable. Doctors and nurses may be forced to flee for their safety, leaving already fragile systems even weaker. In conflict-affected areas, people not only face injuries and trauma, but also lose access to routine healthcare services such as vaccinations, maternal care, and treatment for chronic diseases. Corruption is another serious issue that affects healthcare systems in poor countries. Funds that are meant to improve hospitals, purchase medical equipment, or pay healthcare workers are sometimes misused or stolen by officials. This results in fewer resources reaching the people who need them most. For example, money allocated for building new healthcare facilities may be diverted, leaving communities without access to proper medical care. Corruption reduces trust in the system and discourages both local and international investment in healthcare development. In addition to financial corruption, there may also be issues of favoritism and inequality in the distribution of healthcare services. Resources may be allocated based on political influence rather than actual need. Urban areas or regions that support certain political groups may receive better healthcare facilities, while rural or marginalized communities are neglected. This unequal distribution further widens the gap between different populations within the same country, leaving many people without adequate access to medical care. Weak governance and lack of accountability also contribute to poor healthcare outcomes. In stable and well-governed systems, there are mechanisms to monitor how resources are used and to ensure that policies are effectively implemented. However, in politically unstable environments, such systems are often weak or non-existent. This allows inefficiency and mismanagement to continue without consequences. As a result, healthcare programs may fail to achieve their goals, and resources are not used in the most effective way. Finally, political instability discourages long-term investment in healthcare. Both governments and international organizations may be hesitant to invest in countries where policies can change suddenly or where funds may not be used properly. Without consistent investment, it becomes difficult to build strong healthcare infrastructure, train professionals, and improve services over time. This lack of stability creates an environment where healthcare systems cannot grow or adapt to the needs of the population, leaving millions without reliable access to essential medical care. In conclusion, the struggles faced by healthcare systems in poor countries are the result of multiple interconnected challenges. From lack of funding and shortage of healthcare workers to poor infrastructure, high treatment costs, limited education, and political instability, each factor plays a significant role in weakening the system. These issues do not exist in isolation. They reinforce one another, creating a cycle that is difficult to break. When resources are limited, systems cannot improve, and when systems are weak, populations continue to suffer from preventable diseases and inadequate care. However, these challenges are not impossible to overcome. With better governance, increased investment, improved education, and global cooperation, healthcare systems in poor countries can be strengthened. Every individual deserves access to basic healthcare, regardless of where they live or how much they earn. It is not just a national responsibility, but a global one to ensure that healthcare becomes a right, not a privilege. Only by recognizing these problems and working together to solve them can we move toward a healthier and more equal world for all.